Good morning, everybody, and welcome to your How to Manage Sickness and Absence in Your Business, which is our free webinar today from the Curve Group. Just before we get started, I'd just like to cover a few housekeeping notes with you. Please feel free to participate using the question and answers facility that we've got. Silence any mobiles if you can, just so that they don't distract you in any way. You will have noticed that as you've joined that you have been muted on entry, and that's just so that we can keep the background noise down. Please do ask, as we've already said, as many questions as you need to, and just please, as I keep linking back to you, do get involved and participate. The session will be recorded for future reference, and what we will do is following this session, once the recording is downloaded, we will send you the link across. My name's Anna, I'm going to be your host today, and my contact details are on the screen now should you need them. The estimated time of today's webinar is approximately 30 minutes at the most, with time built in for questions and answers as well. So just a little bit more about the Curve Group. We are HR and recruitment solutions specialists, and we cover everything across the employee life cycle. So that's everything from workforce planning all the way through to selection and screening, induction, employee relations and advice, which is what today's webinar falls into, and of course everything again all the way through to change and exit management as well. We're very proud of what we deliver. We are a privately owned organisation, and just up on the screen now you'll see a small selection of some of the awards that we've won over recent years. But now what I'd like to do, and most importantly, is hand you over to both Caroline and Laura. Caroline is our Head of Employee Relations and Laura is an Employee Relations Advisor, and these ladies will be taking us through the webinar today. So Caroline, over to you.
Thanks, Anna. So what we'll be discussing in more details in this webinar is what is absence management, types of absence, the legislation which you need to consider, why is it important to manage absence, short-term absence, long-term absence, and the main causes of absence, COVID-19, effective absence management, disability and the Equality Act, mental health, reasonable adjustments, GP and occupational health referrals, and a question and answer session at the end. So first of all, what is absence management? Effective absence management is about supporting employees with health issues to stay in or return to work. So what legislation affects absence management and needs to be considered when managing absence? The ACAS Code of Practice on Disciplinary and Grievance Procedures, together with the employer's own procedures, should be utilised when addressing sickness absence. Employees may need to make reasonable adjustments to support employees who have a disability or long-term health condition, and that is outlined in the provisions under the Equality Act 2010. Both physical and mental health conditions might be covered under this legislation. In cases where it is necessary to request a medical report from a health professional, it is essential to follow the Access to Medical Records Act 1988, and employers must be careful not to breach the Data Protection Act 2018, the DPA, when they collect, use and store information about the employee's absence. So details about the employee's health, physical or mental, are categorised as sensitive personal data.
Okay, so there's a number of reasons that employees may take time off work, and these are short-term sickness, long-term sickness, other authorised absences, so examples of this are family leave, compassionate leave, or time off for public duties, unauthorised absence and lateness. Now, clearly each of these needs to be managed in different ways, and today we're going to be focusing on short-term and long-term sickness absence.
Okay, so I've covered this. I just spoke on the wrong slide, so apologies. But just to cover the legislation to consider, there's the ACAS Code of Practice, the Equality Act, the Access to Medical Records Act, and the Data Protection Act, the GDPR, which I've spoken about. Got my slides muddled up. Next slide, please, Anna. So why is it important to manage absence? So first of all, it's the cost to the business. Employee absence is a significant cost to businesses. These costs include covering absences and, of course, the time taken to manage these situations. The authors of Expert HR's 14th annual survey into sickness absence rates and costs said the cost of sickness absence in 2019 stood at a median of £568 per employee. A recent survey by the CIPD gathered data on sickness absence levels and causes. The 2020 report actually showed that sickness absence is at its lowest, 5.8 days on average per employee in a 20-year history. It's worth noting that this doesn't necessarily mean workplaces are becoming healthier or that people are becoming less unwell. The results of the survey showed a large number of respondents having seen presenteeism, so that means working when unwell, and also leaveism, which using holidays to work. So aside from the statistics, other things that make absence management so important include that we have an ageing workforce. So as the workforce ages, people are more likely to develop long-term health conditions and or disabilities. And so it is important that employers develop supportive workplaces that help people to manage their health and work. So it's really important to have a clear process for managing sickness absence and demonstrating a consistent approach. It is important that you treat employees fairly and consistently, which is why we often use trigger points, something which we'll come on to later on. Effective absence management will ensure that you're able to identify any employees who may need additional support or reasonable adjustments in order to effectively do their work. And the last point we have here is help to reduce disruptive, short-term persistent absence. Something which we assure you will agree is really important. It is not currently clear the full impact of COVID-19 has been on sickness absence rates, but either it is clear that we often underestimate just how much these costs can be. Okay, so getting absence management right means finding the right balance between providing support to the employees with health conditions to stay in work or return to work, and taking in a consistent and firm action in the minority of cases where employees could try to take advantage of any sick leave entitlement, causing unnecessary disruption to the business. Over to you, Laura.
Okay, so as we mentioned at the start, today we're focusing on long-term and short-term absence. So we've provided you with a quick overview of each. So looking at short-term absence first, there is no legal definition of short-term absence. However, many employers define this as an absence of less than 4 weeks. A good starting place here, if you're not sure, would be the company absence policy. If this isn't something which you currently have in place, we would recommend looking to implement this, as this will really support you with your absence management. If you would like some support with this, please do get in touch. Now, persistent short-term absences are usually more disruptive to the business than long-term absences, so it's really important that you've got a clear process which is applied consistently in dealing with this. Long-term absence, again, has no legal definition, but it's usually defined as an absence lasting at least 4 weeks. The longer an employee is off sick, the harder it can become for them to return. So regular communication and a formal return to work strategy is really important in these cases. It is, of course, important to be sensitive in the approach to contact with the employee, and you should also pay attention to potential disability discrimination issues. So absences relating to disability often need to be dealt with differently. So what are the main causes of absence? According to the CIPD Health and Wellbeing report, the main causes of sickness absence have been identified as follows. So minor illnesses, this includes colds, flu, stomach upsets, headaches and migraines. Mental health, so for example, depression and anxiety. Musculoskeletal injuries, including back pain. Stress and caring responsibilities for children. Now, we couldn't let the session go by without making reference to the coronavirus pandemic. This has, of course, had a significant impact on health and well-being and also needs to be taken into consideration for effectively managing sickness absence. UK government guidance and health measures mean that many people need to self-isolate. And employers have to support staff who have or live with someone who have COVID-19 or symptoms. SSP is also payable from day 1, as opposed to the usual day 4 for those affected by coronavirus when self-isolating. And employers with fewer than 250 employees can also claim a refund for COVID-19 related SSP costs, and this is for up to 2 weeks per employee. Employees can self-certify for the first 7 days as normal, and the government has also introduced a temporary alternative to the fit note, whereby those in self-isolation can obtain a notification via NHS 111 as opposed to visiting their GP. An alternative option to providing sick pay is to allow people who are asked to self-isolate but are not unwell to work from home wherever possible, and this would mean that you would continue to pay as normal. Many companies have chosen to treat sickness absence or self-isolation related to coronavirus outside of their normal sickness absence reporting system. It's to be expected that some employees may need to self-isolate multiple times. So, for example, until they receive a negative test result. And we would advise against counting these as part of a trigger system. So, effective absence management and absence policies. Caroline, over to you on this one.
Thanks, Laura. So we've had a quick look at the different types of sickness absence, and it's time for us to provide you with some tips for effective absence management. So internal policies are one of the first things which need to be considered when managing sickness absence, as this will provide guidance both to the manager and sets a standard for the employees. To help you when reviewing your policies, we've put together a list of key things which a company absence policy should include, and these are on the screen now. Unfortunately, we don't have time to go over these in detail today, but please do get in touch if you would like further details. Next up, we would recommend looking at how you record and monitor your monitor your absences. So why is it important to record and monitor absences? So it highlights areas of concern. For example, you may notice that there is a high level of absence in certain department or area of the business. This could prompt you to look into causes of this, and it allows you to have a fully informed discussions. So it's important when speaking with colleagues, especially when it comes to taking more formal action, and you'll need to refer to accurate information which you've gained from these discussions. So it may show patterns in absences. For example, if all absences seem to fall on a Friday or Monday, which it is important to be, however, it is important to be cautious of making any assumptions without any evidence recording these absences. It wouldn't allow you to build the opportunity to build a picture and for these to be discussed. Data will support you in measuring if absence management is effective. So, especially where you're making changes to the process, having clear records of the absences can help you see if the steps you have taken have had any noticeable effect at all. So what should you record? So the absence dates, the reasons given for the absences, notes from your return to work discussions, self-cert forms or fit notes from the doctor, and records of any reasonable adjustments that you've made and how long you've made them for. The employee's GP, so fit notes. So I'll give you a little bit more context in this. The employee's GP may also provide additional comments, and these should be discussed with the employee in order to understand and support what can be offered in helping to facilitate a return to work. So this could include making reasonable adjustments, such as providing different working equipment. It's also important to check the information provided by the GP, as it may also indicate the need for further conversations. This is all information which needs to be given really careful consideration. Over to you, Laura.
So in order to effectively manage absence, you need to be able to ensure you have a process in place which allows you to measure it accurately. And there's a number of different ways that this can be done. Some common examples include a trigger point system, the Bradford factor, and lost time rate. We're often asked for advice around what we would recommend, and we would usually suggest a trigger point system. A trigger point system is something which can be set out by an employer which assigns points to different absence reasons. So for example, points could include more than 3 occasions in a rolling 6-month period, or a total of more than 10 days in a rolling 6-month period. This allows for more flexibility because you can tailor it to your needs, but absence should of course be managed on a case-by-case basis. Particular care also needs to be taken in order to ensure that pregnancy-related illness, authorised leave and disability-related absence are managed in an appropriate manner. A failure to give due consideration here could lead to tribunal action if the employee is unfairly disciplined as a result of reaching a trigger or scoring too highly on a trigger system as a result of this. Now, looking at return to work meetings, we've given you some basic guidance around this on the slide. They should be conducted after every absence, and that's regardless of the length of the absence. The meeting ensures that the employee feels fit to return and therefore needs to be completed before they commence any work. It's also an opportunity to discuss any adjustments, so for example, how a phased return may work. The meeting should also be used to bring the employee up to speed and where necessary to review their absence levels and make them aware of any triggers which have been reached. This is very much a two-way conversation, so listening to and empathising with the employee is important here. So what we've done with you now is we've provided you with a basic overview of dealing with cases of short-term absence. So first of all, the notification process. So each company will set out its own expectations with regards to absence notification, and we would recommend reviewing your absence policy to ensure expectations for absence notification are clear. Please get in touch with us if you need any support with this. Next up is updating absence records. So as Caroline's just covered, keeping your absence records up to date and in one place makes it much easier for you to review absence levels and also to identify any links in reasons or patterns which may lead to further discussions with the employee. Next is the return to work meeting, as we've just covered. It's important to make sure you fully understand the reasons. For example, if there's any underlying health concerns. Absence management, as we've already mentioned, will be on a case-by-case basis, and there's a number of different options at the end of this process. So having spoken to the employee, it may be a case of implementing adjustments where underlying health concerns have been identified. As a last resort, where triggers have been reached and no underlying medical reasons have been identified, the next step would be to move to the disciplinary process or a capability process, depending on your internal policies. It may simply be at this point that the decision is to continue to monitor the absence. Looking at long-term absence now, so we've given you a similar overview here for the process for managing this. For long-term absence, we believe the most important part throughout the process is maintaining contact. So maintaining contact with colleagues who are unwell in a sensitive manner will help to prevent them feeling isolated and will also make sure they don't feel cut off from work. This is likely to make them feel more comfortable to return to work and will also help them to understand that they'll be supported in doing so. Just remember, the longer an individual's absent for, the harder it often becomes to return to work. So this part of the process is really important. Next up is planning and implementing workplace adjustments where necessary. And this should, of course, be in collaboration with the individual. Accessing professional medical advice and treatment, so particularly in cases where you believe further adjustments may be required or where it's uncertain when or if an employee is going to be able to return to work. Next is the return to work plan, and this is going to be dependent on the nature of the illness and any medical information provided by the employee up to this point. It may be that a risk assessment is necessary on return to work. As part of reasonable adjustments, there may also be a requirement for new equipment to be put in place. And that's for the individual obviously returning to work. Again, there's a few ways that this can go at the end. So in cases where an employee is able to return to work, it's important that you implement and adhere to the return to work plan discussed with the employee and any medical professional advice, and regular evaluation needs to continue with the employee about how they're adjusting to being back at work. In cases where the employee is unable to return to work due to medical reasons, the capability or disciplinary policy, dependent on your internal procedures, will need to be followed again. Ultimately, this will lead to dismissal, but again, this should very much be a last resort. Over to you, Caroline.
Thanks. So, the Disability and the Equality Act. The disability is defined in different ways for different purposes. For the purposes of employment law, the UK definition is contained in the Equality Act 2010. So a person is disabled if they have a physical or mental impairment which has a substantial and long-term adverse effect on their ability to carry out normal day-to-day duties. So long-term means a condition must last or is likely to last for more than 12 months, or it is likely to last for the rest of their life. So individuals with cancer, multiple sclerosis, HIV and AIDS are covered from the date of diagnosis, regardless of the impact that the illness is having on their life at the time. The definition of disability is therefore very broad. This means that many other conditions could be also potentially be covered, including, for example, chronic fatigue syndrome, schizophrenia, arthritis, or severe nut allergies and depression. To be covered under the Act, a condition does not need to have be clinically well recognised or diagnosed. So employers should focus on the effects an employee is experiencing at work and not the disability or condition from which those symptoms may emerge. So many people with a disability or condition which could potentially be covered by the Act may not necessarily identify as or consider themselves to be disabled, even though they may still need adjustments to support them in the workplace. So in practice, this means that employers may need to make reasonable adjustments for employees who do not think or even say that they're disabled. So as a rule of thumb, we usually go for employees that have an underlying health condition. So when you look at your return to work interviews, if you see like a similar pattern occurring there, or they're offering the same illnesses, you need to do a little bit more digging and see if that's as a result of an underlying health condition. And it's also important to note that only an employment tribunal will decide whether the person is disabled or not for these purposes. So, mental health. So persistent long-term absence or disruptive intermittent absence could be a sign of poor mental health. So take note of other signs such as low mood, mood swings, uncharacteristic and erratic behaviour. So how do we manage this? Well, early identification is the key. Spot patterns in reasons for absences. So I just covered there that looking at your return to work forms or your reasons for your absence. Is it for the same thing? Are they on the same days? Is something triggering these? So employees may not feel comfortable in stating stress, anxiety or depression as their reason for absence. So make sure that they feel comfortable in coming to you and being able to have that open and honest conversation. So don't shy away from these important conversations. I've had managers, we've advised managers before saying, oh, I can't discuss that or whatever. It's important to get to the bottom of the real reason, otherwise we can't help. So open and honest discussions in return to work meetings and one-to-ones. Over to you, Laura.
So there's a responsibility for UK employers to make adjustments to accommodate the needs of a person with a disability. Employers have to understand the barriers an employee is facing, and where it's possible to do so, must put adjustments in place to resolve these. The employee should be involved in discussions with the employer about adjustments. However, the responsibility to make adjustments is ultimately the employer's. The legal requirement is to make adjustments which are considered to be reasonable. This duty falls on the organisation as a whole and not just a line manager in a department. So the resources, including finances and equipment of the whole organisation, need to be taken into account when deciding what is reasonable. Reasonable adjustments must be considered with a specific individual and their specific role in mind. So adjustments could include modified or specialist equipment. So for example, height adjustable desks, providing an interpreter, alterations to the workplace. So this could include ramps or automated doors, training. This might be necessary to support with new adjustments. So for example, where specialist software, where you've provided specialist software to the employee. Time off to attend medical appointments. So for example, to attend counselling. It's important to make sure that the employee doesn't suffer any detriment in relation to these. And these adjustments should be identified usually through discussion with the employee and their line manager, or perhaps following a referral to the employee's GP or occupational health. So as mentioned there, so looking at GP reports now, so a GP report might be requested for a number of reasons. So for example, where you're considering dismissing an employee due to capability reasons, or where you're looking at whether the employee has a disability and therefore requires reasonable adjustments at work. You may need some more specific guidance on the reasonable adjustments which can be implemented. So the employee's GP will be able to provide relevant information from the employee's medical record, such as how long a medical condition is likely to last, how this affects them, and how the company can support this. You of course need to make sure you seek consent from the employee in doing this, and also fulfil your obligations under the Access to Medical Records Act, which Caroline covered at the start of the session. Looking at occupational health now, so this can also support an absence management process, and this is something that we utilise more often than the GP referrals. There's a large number of services offered by occupational health providers, and this slide shows the most common services which may be offered as part of absence management. So these include advising likely timescales of absences. So this is particularly helpful in cases of long-term absence. Providing information to help facilitate a return to work. So advice on reasonable adjustments. Assessing fitness for work. This could support with decision making around ill health capability dismissals or even ill health retirement. Other services include advice on ergonomic issues, counselling, and assessing where work has impacted an employee's health. The services which an organisation decides to offer will depend on the nature of their business.
Thank you very much, both. So we've now concluded the main body of our webinar today, giving you an overview of managing absence and sickness, both long-term and short-term. And now's your opportunity to ask any questions. So if you do have any questions, please do pop them in the open up the question and answer panel and pop any questions that you've got. And then Caroline and Laura will be more than happy to answer them for you. Okay, I don't have any questions coming up at the moment, ladies, so I'll just give it a couple of more minutes. Okay, it doesn't look like we've got any questions coming up, which is absolutely fine. Just to clarify a couple of things for you, we are here to lend a helping hand. So we do offer an on-demand HR support service to resolve any sickness and absence issues, sickness, absence policies and training, or any other outsourced HR and employee relations services for line managers. So please do reach out if we can help you at all. We've got some other free webinars that we've run already, so they're available on our website, so please do have a look at them. We've run some on redundancies, outplacement and IR35 as well. And finally, we'd like to take the opportunity to say thank you very much. Last chance for any Qs and Q&As if you do have any. Alternatively, as we said at the start of this webinar, we will actually be sending you the link to the recording of today. Thank you very much. Thank you, Laura. Thank you, Caroline, as well, for hosting the session for us today.
Thank you.
Thank you.
And I'm now going to conclude the webinar. Thank you very much.